DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. We're going to have a great show. Dr. Scott Radke is going to be here with us. We're going to talk about springtime toxicology in your cow herd. It's going to be a blast. Great to have him on the show. Stay tuned.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. We're at Iowa State University at the College of Veterinary Medicine, where we are blessed to have Dr. Scott Radke here with us today. Dr. Radke is an assistant clinical professor here in the Veterinary Diagnostic Lab in the College of Veterinary Medicine, where he is a board-certified toxicologist and the lead of the toxicology section here for ISU, which is a lot of rich history here in this veterinary school, and a lot of rich history in the toxicology section of the veterinary school.
Yep, certainly a lot of history there in the toxicology section, Dan. And first of all, glad to be here and talking with you today on grass tetany and spring toxins.
Oh, it's going to be awesome, and so let's get into some of that, Scott. As we talked earlier, we have some general clinical signs of different CNS or toxin type disorders that we can witness in the springtime, right?
Yeah, that's correct. There's a number of things that we can see from a neurological standpoint, especially when we come to certain toxins as well as grass tetany that we'll plan on talking about a little later here too.
Yep. So what are some of the general things that people would see that, cow down or cow rigid? I mean, what are some of the things?
Yep. So when we're talking about grass tetany, one of the most common things we actually see from a practitioner's point of view is commonly found dead in the middle of the pasture. But if we do see clinical signs with grass tetany, typically they're neurologic in nature, tremoring, ataxia. Animals become recumbent, go down, start convulsing or have seizures, down and paddling as well. Those are the typical common clinical signs that you may observe in those situations in regards to grass tetany.
Yeah. So, and that, that was always, whether it's a feed yard or a pasture, found dead is, so many different types of things start going through the Rolodex, from lightning strike to grass tetany to many different toxins, acidosis. But, what are some of the things then you kind of recommend once we find that animal dead or we have these clinical signs, is get a veterinarian involved with the case?
Yeah, definitely. I would definitely recommend getting your veterinarian involved in this because they have a pretty vast knowledge of what differentials they want to put forth, and that's really going to drive your sample collection, your diagnostic testing. One thing I do want to clarify is that sudden death is not the same as found dead suddenly. So have to establish that first. But as far from a neurologic standpoint, I know we're going to talk about grass tetany and the neurologic signs that it produces as well. We have a number of other differentials to think about and consider from a tox standpoint in the spring. Some of those that come to my mind initially would be lead is a big one come spring, especially with turnout of calves and cows onto pasture. You can potentially get exposure to old batteries that have cracked open and overwintered. Not a good situation there. You always run the situation with potential pesticide application or pesticides that were dumped in a corner of the field or misapplication. So those can also produce neurologic signs depending on what class you have, and that can also create some other additional complications in cattle. Nitrate, urea with non-protein nitrogen sources, also on my differential list for things that need to be considered out there. And some of the sampling collection, sampling diagnostics are similar between those agents.
Yeah. So we're going to talk about grass tetany. We're going to talk about lead. We're going to talk about some of these insecticides, pesticides. The goal of this is we got someone here that's an expert that's seen a lot of these cases, and we're going to pick his brain, and we're going to talk about some of the things you need to look for in your spring cow herd. Keep them health, safety, work with your veterinarian. We'll be right back.
Nasalgen 3 is a new 3-way intranasal BRD vaccine that offers young calves unrivaled protection against devastating respiratory diseases, including IBR, BRSV, and PI3. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose new Nasalgen 3 PMH, the first and only 5-way intranasal vaccine on the market. Talk to your veterinarian and visit nasalgen.com to learn more.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
It's the drive, the passion, the unbridled desire to be the world's greatest. It's the early mornings, late nights, and every hour in between spent grooming the next generation of champions. We're with you through the best times and the tough times. Seeing your horses through inevitable health scares and setbacks you never saw coming. Everything they deserve is here, delivered fast. We'll work hard for you so you can work hard for your dreams.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here with Dr. Scott Radke. And Dr. Radke is a toxicologist here and leads the toxicology section at the Veterinary Diagnostic Lab at Iowa State University's College of Veterinary Medicine. And Scott, as we were talking about different things, this grass tetany is, as you come into the spring, something we need to be concerned about.
Yeah, certainly, Dan. It's one of those main concerns here, especially when we got turnout of cattle, cows that are in late gestation, early lactation onto lush pastures, small cereal grain pastures. We run that risk of hypomagnesemia and resulting, commonly known as grass tetany, but mostly as a result of low magnesium in the diet.
Okay. And so, like you said, we'll come out, we'll find a cow paddling, and the first thing is if you have that and you don't have the proper treatment, or your veterinarian hasn't left you with something to case definition treatment protocol product, get the veterinarian involved.
Yeah, certainly. Definitely want to call right away, especially in cases of grass tetany, because those acute cases, they need to be treated immediately, and you want to contact your vet so they can bring out the proper equipment, proper medications for that process.
Okay, so I'm going to assume that then the treatment for these is getting magnesium into these cows, and some sort of, some of the different IV solutions and things. These cows can come out of this pretty quick.
Yeah, generally, if they're given properly, if the treatment's administered in a timely manner, a lot of these treatments, the IV injections, are the same what you treat with milk fever and whatnot, because they have calcium and magnesium.
Yep.
Generally, these cattle will come out within the hour or so. But we also have to keep in mind that cattle that do have grass tetany need to be monitored afterwards, because there is potential for relapse, and you have to retreat those individuals.
And so then this decrease in magnesium, there's two reasons why we can have the decrease in magnesium. Either it's not available or it's tied up, right?
Correct.
So figuring that out is probably important as well, correct? With different low quality forages versus lush pasture and into your bale feeding and different things of that can complicate things.
Yes, definitely. And any particular feed associated case or nutritional case can be fairly complicated, and especially antagonism, if we have different minerals working against each other. In the case of, we mentioned tying up with magnesium or not getting enough. Lush pastures high in potassium, and the forage material there, but high potassium in the diet can prevent the drive of magnesium absorption through the rumen, resulting in lowered amounts of magnesium in the body system itself. And ultimately, you have a deficiency there, you have your clinical signs.
Yep. And, some of these we've seen treated in the pasture respond immediately. And they're not always a happy cow coming out of this. But high mag mineral in the spring important, I take it?
Yeah. And full disclosure, I'm not a nutritionist, I'm a toxicologist,
Right.
but I definitely recommend high quality mineral, even if it's multiple buckets of free choice mineral out there. Take into account how many animals you have, how much mineral you're actually giving them, just making it available to them as a preventative measure to supplement magnesium to those cattle.
Always work with your local nutritionist, work with your local veterinarian, get a game plan to prevent this. A lot of times we're up here talking to you about it because we've seen cases, we've been involved with cases, but really your veterinarian knows your geography, knows the types of grasses and things to that nature, and really a resource to bring value to your cow herd. We're going to take a break. When we come back, we're going to talk more with Dr. Radke on things that we're going to see in the spring in your cow herd with toxicity.
We are a start to finish yard, bring them in at 500 pounds and finish them out to 14 to 1,500 pounds. Max capacity is about 15,000. We begin with the end in mind, which that means it starts from day one coming off the truck. Heard all sorts of stuff about the generics coming out from a few different companies here and there, but we started working with Vimeda. What I like about working with Vimeda is our rep. He seems like he's just one of us. He knows, he's been in the cattle feeding industry for a long time. He understands where we're coming from, what goes on in the feed yard. So we started implementing Magnesium last July, and we're using it as our first poll treatment. The data shows that success rates on BRD, they're equivalent to the other macrolides that we were using. We just feel fortunate enough, I guess, to get our hands on it, and it works great for us for a first poll treatment. It's what really jumped out to us working with Vimeda, meeting with the rep. Magnesium's affordable. We finally got a product that everybody can afford. We try to do the little things right, whether it's from low stress cattle handling, animal welfare, how we work with the cattle every single day. That's something we really focus on, but when you've got a product like a Magnesium, it's just another assurance, protecting you, controlling your BRD from what stressors are thrown out there or what Mother Nature is going to bring to you. This industry, it takes everybody, whether it's working with the nutritionist, it's cowboys working with the veterinarians. Everybody plays a part, and we expect them to do their jobs, but also we expect the drugs or what we put into the cattle to do their job too. And I think these Vimeda products, they're proven that they're doing the job for us.
Dr. Nels here, folks. We're super excited about this book on hiring. Have you made a bad hire? Have you hired someone you wish you wouldn't have? Are you looking to hire? It's a great short read on helping you in the hiring process. You can find it on Amazon, Kindle, Audible, or find it at drnels.com. Check it out there. We'd love to see you there.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. Scott Radke. We're here at Iowa State University's College of Veterinary Medicine, where Dr. Radke serves as the lead for the toxicology section here. He's a boarded toxicologist, and really lucky to get his time and expertise. If you have a toxicology case, this is the guy to bring them to. When we were talking during the break, one of the things that we were wanting to mention at the end, we ran out of time, is about potash and grass tetany.
Correct. Yeah, so considering, one of the things you also have to consider for predisposing factors for cattle to get grass tetany is what fertilizer has been applied to that particular piece of ground. In this case, we were talking about potash, which can be high in potassium. So again, I mentioned before, high potassium in the diet can inhibit magnesium absorption in the rumen. So always be conscientious about, hey, are we putting cattle out on pasture this has been recently applied to? Are we going to be running a risk there?
You bet. It's vital to understand that. But then you get into, because this is one thing about toxicology, they get they get these cases that are not good for us as owning the cattle or that, but they're so exciting to talk about. I mean, this is like, but let's talk about, because you mentioned lead could be an issue in the spring.
Yeah, certainly lead is a big issue in the spring. I term it as lead the fifth season of the year, because usually in spring, that's the time we'll go ahead and calves and cows are getting turned out to pastures. Well, consider what the pasture's perimeter is like. Is it an electric fence? Do you have batteries out there? Was there any junk stored out there over winter? And if they forgot about a battery, was it cracked open, exposing the lead plates and the casings? That's a pretty common occurrence. We get those calves love to seek that out, even the cows, and they'll go ahead and chomp down on it, lick those lead plates, and then we got an issue.
Oh man. And so when we get into a lead toxicity case, I'm going to assume that, found dead or a CNS non-responsive type case, what kind of samples do you need for a lead case?
Yeah, so for a lead case in particular, especially animals that have died already, liver is the primary tissue sample we're going to want for just direct testing of the lead in and of itself. If you see an animal with neurologic cases, I always mention it's not everybody's favorite sample to take, but take the brain out.
Oh, yeah.
Make sure we rule out not just, even if we got a pretty good indication it might be lead, we want to rule out infectious diseases as well. Make sure there's nothing on the brain there too.
Yeah, polio, listeria, all the different CNS types of histophilus. Very, very important. So does it take, the question is does it take a lot of lead or a little lead? I mean,
yeah, so,
I don't know. I mean, I was raised when there was lead-based painting on all the walls, so that's my excuse. But anyway, how much does an animal, do they have to eat a whole battery or?
Don't have to eat a whole battery generally. It just can be small amounts over a brief period of time. It doesn't take a whole lot to affect an animal. And it depends on the size of the animal. Calves are far more susceptible than adult animals are, so it takes a little bit less than them. I've seen the classic battery case. That's probably the most common one, but I have had instances where lead paint has been ingested by cattle as well that have fallen off the barn or pressure washed off or just happened to be in a pile out in the pasture.
And they ate the chips
Yes.
and got toxicity. And so, what do we do with cattle if they've been infected with lead?
So again, most of the time we see these animals, they're neurologic in nature. The adults, some of them are found dead, a number of them are. By that time, many times it's far too long to do anything, but there are some chelator options out there. However, there's a bit of gray zone with those chelators because of approval for use in them.
Sure. So again, work with your local veterinarian, work with your U.S. FARAD, different things on that for withdrawal times and what we can do.
Yep.
Great. All right, we're going to take a break. When we come back, we'll talk about some other common spring type things like insecticides, pesticides. We got Dr. Scott Radke here. We'll see you after the break.
I'm Dr. Les Anderson. I'm a beef extension specialist at the University of Kentucky. The Alertus on-farm test has the opportunity to completely change the industry. A producer is enabled and empowered to be able to take the sample and run the test or tests at their leisure without scheduling anybody. And honestly, reproduction is the thing that we measure the least, and it's the thing that dictates profitability the most. The Alertus on-farm test will help us to identify cows that get pregnant early. It'll improve our efficiency tenfold.
As a stocker operator, your job is to turn forage into profit. With the right implant, you can. Revlor G improves grazing performance for 150 days, the same length as the typical grazing period. And it's dosed for stockers' maturity levels, adding up to an extra 23 pounds. See why Revlor G is the #1 choice in stocker implants at RevlorG.com. A withdrawal period has not been established in pre-ruminating calves. Do not use in calves to be processed for veal.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. Scott Radke. We're at Iowa State University's College of Veterinary Medicine, where we were both students.
Yes.
Both alumni of this institution, and fine institution it is. And Dr. Radke serves as our lead toxicologist for the veterinary diagnostic lab here at Iowa State University's College of Veterinary Medicine, and gets to see some pretty cool cases and does a lot of work with beef cattle cases. And so we've talked about grass tetany, we've talked about lead, and now another springtime issue that you see is pesticides or insecticides, and kind of, why?
Yeah, so it's another common thing we see every once in a while is certain pesticides, especially insecticide compounds, is one, people are getting ready to go out in the fields, they're getting ready to plant, getting equipment ready, tuned up. We may have some flushing of pesticides on the ground. We may have it put into buckets. Those buckets may get misplaced, mislabeled, potentially, worst case scenario, added to the ration at times if they're mistaken for mineral mix. We've had other situations that we can see with piles of grain or treated seed that's left over that just gets dumped out in a pile to be removed. Well, animals being curious, they'll find that pile undoubtedly, and we have some issues there. So those are some of the common situations we've seen with insecticides in the spring.
Yeah, so, and I can see it too, and then we have shared water tanks and not getting them completely cleaned out, or putting water into them and then hauling water to cows or different things like that. Could see where those goof up. So what are some of the, how do those calls happen?
Yeah, so those calls typically happen. I work in a diagnostic lab. I usually get the call once there's a problem that's started, or if they have questions leading up to should we use this, especially when it comes to the tanks. So usually when I get the call, we've got an issue already ongoing. But I would like to touch on the tanks you had mentioned, not just the insecticides, but another two common poisons we see with water tanks being hauled out is making sure that clean tanks that are devoted just to water are used. I've can't tell you how many times we've had cases where a fertilizer tank has been washed out 3 or 4 times with detergent water still used, and all of a sudden you still got enough residue in there to cause complications in animals from a nitrate and urea standpoint.
Yeah, I could completely see that. So be very careful on farming and ranching, farmer feeder, different types of things where you have a agronomy section to your business and an animal livestock business. Just making sure that we keep some of these things separate.
Yeah, definitely.
Any other types of issues, or springtime or fall time, or things that you've seen, or?
I guess in the springtime for cattle, I mean, it's, again, from a nutritional aspect, we see, especially with spring calvers, potential vitamin deficiencies, mineral deficiencies, especially if cows and heifers have been taken off pasture early. They're on a certain diet that's just the only component of their diet, not a lot of forage, or if they're lacking a trace mineral or mineral program in general. So we tend to see that in the spring months as well in younger calves.
Awesome. Well, I just want you to know this has been great, and it's always good to get you or Dr. Inslee on the show to discuss toxicology.
Yeah, much appreciated.
So, folks, thanks for watching the show today. Remember, always work with your local veterinarian. If you want to know more about what we do at DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thomson, here with Dr. Scott Radke from Iowa State University, and we'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Valley Vet Supply sees the hard work and effort of you and your animals to achieve your goal of being a champion. And we're here to help along the way. To the cowboys and cowgirls, to the dreamers, we see you.